Yeah, well, you were switching. It's totally understandable. I know. But I'm also not going to let you go on your side.
Hi, Gina. Nice to meet you.
We're live.
Bienvenue. Welcome to Bendale Acres. I am Gina Stringer, Administrator, and on behalf of our residents, their loved ones, our amazing team of interprofessional staff members, and our vibrant volunteers, we are pleased that you could join us here today. Bendale Acres is a thriving part of the community. We have on-site child care center and an adult day program. The Pavillon en Mer de Laurier is our French language services home area. Our newly opened Highland Creek Retreat is a transitional behavior support unit which provides accommodation, care, services, and programs for residents with responsive behaviors who need extra support to transition into long-term care. Land acknowledgement for Scarborough. The land I am standing on today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and the Williams Treaties signed with multiple Mississaugas and Chippewa bands. African ancestral acknowledgement. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers, as migrants, either in this generation or in generations past, and those who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Thank you. Now it is my pleasure to welcome MPP David Smith.
Thank you, Gina. Good morning, everyone, and thank you for being here today. I am David Smith, member of Provincial Parliament for Scarborough-Centre. I'm thrilled to be here today with my colleague, Minister of Long-Term Care, Paul Calandra, MPP of Scarborough Rouge Park, Vijay Tanigasalan, to share with you how our government under leadership of Premier Ford is fixing long-term care to ensure our seniors get the quality of care and life they need and deserve. In the summer, our government introduced our plan to stay open, a great plan to provide best care possible to patient and long-term care residents while ensuring the resources and support are in place to keep the province and economy open. The plan aimed to further bolster Ontario's healthcare workforce, expanding innovative models of care that provide better, more appropriate care to avoid unnecessary visits to emergency departments, and free up over 2,500 hospital beds to ensure beds are there for patients who need them when they need them. Bolstering staffing in long-term care and continuing to address the needs for more healthcare capacity across the sector is part of the government's work to improve care and health outcomes for long-term care residents. Our government is investing $4.9 million over the next 4 years, including $673 million this year, to hire more than 27,000 long-term care staff to ensure that long-term care residents receive, on average, 4 hours of direct care per day. Without further ado, it is my distinct pleasure to turn it over to my friend, Minister Calandra, for today's exciting announcement. Thank you.
Thank you so much, sir. Appreciate it. Well, thank you very much. Thank you, Dave. And it is obviously very nice to be here with both my colleagues, MPP Smith and Vijay Thanagasalam from Scarborough Rouge Park. Both have done exceptional work in helping us get to not only to this today, but certainly Vijay in the last term of Parliament helping get to the investments that we've made in long-term care across the province, and really Dave just right away taking very active role in helping advocate incredibly well for this community, and of course the work you did before you were elected. I can't thank both of them enough. And to the first and foremost to the residents, I want to thank you for inviting us into your home today. I do appreciate the opportunity to be here and be with all of you, and both Gina and Jennifer. Let me just say again a thank you to both of you. And especially to your teams. The last couple of years, we all know, have been very, very difficult, challenging times, and the staff, the team really has gone above and beyond the call of duty, and we recognize, we certainly recognize that. You know, making announcements like these wouldn't be possible if it wasn't for the extraordinary work that you and your teams and all of you have done. You know, it was interesting when I came. One of the first things I saw was a sign written on the wall back there: "Don't show up to prove, show up to improve." And I think that is awesome, and that is exactly what we're doing today. So look, as you know, I've said it on a number of occasions, our government is taking extraordinary actions to fix and improve long-term care across the province of Ontario. It is built on 3 pillars, and the first pillar we're talking about, of course, is improving staffing. MPP Smith talked about this. We are providing over $4.9 billion to improve staffing in long-term care so that we can get to a North American leading 4 hours of care per resident per day. Now, what does that mean? That means hiring an additional 27,000 healthcare workers for long-term care homes, specifically in the province of Ontario. It is also a recognition and an acknowledgement of the extraordinary work that your teams have done, not only over the last few years, but in the many decades leading up to this announcement that we had made. And again, I thank you for all of that. The second pillar, of course, is driving better quality through better enforcement across the province of Ontario and more transparency with respect to long-term care. We are hiring more inspectors. We have the highest inspector-to-home ratio in North America, and we are working with our homes to ensure that the quality of care that you expect in your home is the highest that it possibly can be. And of course, we are building modern, safe, and comfortable homes across the province of Ontario in every region of the province of Ontario. So there is a lot going on in long-term care, a lot that we have to look forward to. But today I am here to announce specifically that we are investing an additional $5.9 million to expand our innovative behavioral support units program. Now, this funding will create 4 new behavioral supports units, also known as BSUs, in 4 long-term care homes across the province. Now, these BSUs, they provide safe, quality care to residents with dementia and other complex care needs. As Ontario's population ages, the demands and the complex care needs continue to grow, and this will help support that better quality of care that is so important. Now, the BSUs address residents' unique needs by offering specialized and increased staffing, a tailored environment, focused behavioral assessment, and enhanced care planning. The 4 new BSUs, comprised of 79 specialized beds, are in areas where more specialized supports are needed. 2 are in Scarborough, and of course, 1 is right here at Bendale Acres, and 1 is at Extended Care Rouge Valley. 1 will be at Georgian Manor Home for the Aged in Penetanguishene, and 1 will be at Lake Ridge Gardens in Ajax. Now, today's announcement is part of a $9.5 million investment to expand BSU programs across the province. There are already 62 specialized BSU units in Whitby, Mississauga, and in St. Catharines. So that's a total of 141 BSUs directly funded by the government. And additionally, there are 181 specialized BSUs in nine BSUs, that are funded through Ontario Health. So that's a total of 322 specialized beds across 16 BSUs province-wide. And again, I want to thank you two in particular and the staff on this, because it is always challenging to understand how we can make care better in the province of Ontario. And it is your advice, your support, and all of the work that you have done that has helped us realize just how important it is to expand this program across the province of Ontario, and just the results of these types of programs. So I can't thank you enough, and I would be remiss too if I didn't just for a moment, as we are right near the Scarborough Health Network, David Graham, the CEO of the Scarborough Health Network, and the extraordinary work that he has done to help me better understand some of the needs that we are facing across the Scarborough area, in addition to my two colleagues. So BSUs are just one part of the larger strategy to improve health care across the province of Ontario. And it is something that we are going to continue to do. I have had the opportunity as the minister to meet directly with many of the resident councils across the province of Ontario, and I want you to know that we have heard you. We heard you leading up to the election when you told us that the amount of money that the government was providing for food and nutrition programs was not enough, and we increased that. We've heard you by working with the residents' councils and speaking with many of you as I've toured long-term care homes, and you've told us that the people who are helping care for you need more support and better help. And we have heard you. We will continue to listen to you, because as I have said, as Premier Ford has said, we have to acknowledge that a long-term care home is your home. You invited us into your home today, and we will respect you for everything that you have done to help build this province and this country, and we will continue to make important investments by working with our residents and through our residents' council. So I thank you all also very much. But as I touched on earlier, we are making significant investments in long-term care across the province of Ontario. We have the largest building program in the history of this country. Over $5 billion to build 58,000 new and upgraded long-term care beds in every part of the province, north, south, east, and west. And we're not just doing it in urban areas, we're doing it in urban, rural, and remote areas of the province, because one of the things that we heard from many residents in the lead up to this program is that they wanted to live in communities that they helped build. And whether that was in a city or whether that was in a town, in a rural part of this province, we are doing that because you have said you want to live close to home, surrounded by the people that you love, in a community that you are comfortable in, and that is why we are bringing these 58,000 new and upgraded beds to every corner of this province. So I thank you, the residents, for your advice on this, and we have heard from the mayors in some of these smaller communities just how important long-term care, building a long-term care home is to them. It means jobs and economic opportunity for smaller communities. It brings people back home, and they are very excited about it. And at the same time, as I said, again, another special thank you to all of our healthcare workers. We are supporting you. We will continue to support you. We are hiring, as I said, 27,000 additional healthcare workers for long-term care so that we can continue on our path to a North American leading 4 hours of care per resident per day. We could not have done any of this if it wasn't for the staff, if it wasn't for your teams, but most importantly, if it wasn't for the residents of the home that have played such a major role in helping government understand how important it is that we invest in long-term care across this province. So again, thank you for inviting me into your home to make these remarks today. And with that, I will turn it over to Jennifer.
Thank you, Minister Calandra. Good morning, everyone, and thank you for coming to Bendale Acres to make this important announcement about the new behavioural support units for Ontario. The City of Toronto has a diverse, ageing population, and as the General Manager for Senior Services and Long-Term Care, I want to confirm that our team is committed to supporting seniors and people in long-term care to live their healthiest and most fulfilling lives. as they age with dignity. We're committed to supporting seniors in the community to access the programs and support services they need in order to keep them in their homes as they age safely in place, with strong connections that are needed to make this happen. People with dementia and other complex needs require innovative care that's delivered by highly trained and devoted healthcare professionals. Behavioral support units are part of that innovation and what is needed for us to transform long-term care in order to support individuals when they're making their care transitions. On behalf of the City of Toronto, we welcome the additional funding, training, and support so that as we recover from the pandemic, we can continue to transform the way that long-term care is delivered and provide the complex, unique care services around emotion-centered programs that enhance the quality of life while responding to the individual resident needs and the support their loved ones. And now I believe Minister Calandra is going to take some questions, so back over to you, and thanks again.
Thanks a lot, Soraya, if there are any questions, I'd be delighted to take them.
So just going to ask that anyone who has questions from the media, if you please just line up at the microphone here, and in typical fashion, one question followed by one supplementary, and if you have any additional questions, you can circle to the back of the line. Thanks.
Hello, Hugo Levesque with CBC. First question would be, so you said there were BSUs in other parts of the other centers. What have been the benefits for the residents exactly?
Yeah, that's. Thank you for asking that. This is the BSUs and the programs, emotion-centered care, as Jennifer was talking about, have had a tremendous impact across Ontario, and it is something that we are seeing with respect to dementia care and other complex care needs. It's a changing attitude. It's a recognition also that there has to be additional staffing to help people, whether it's dementia care or Alzheimer's. But it's about making homes also sometimes just more accommodating, parts of the homes more accommodating for the residents. I toured Belmont House in Toronto, and they had just completed a small renovation by painting the units in different colors, by offering different therapy programs. So we're seeing tremendous results as a result of the investments that we're making in BSUs, but ultimately it is something that I can't say this enough. I mean, the fact that we're here and the fact that we're able to do this and make this transition is really it's because of the teams that have been working so long across the province of Ontario that haven't had the support that they've needed, frankly. The administrators, the teams that have told us that this is a level of care that works and can have a significant impact in improving the lives of residents who whether it's dementia, Alzheimer's, or other complex care needs.
And as a follow-up, thank you. As a follow-up, with COVID cases rising, are you considering putting any restrictions in long-term care at this point or anything like that? Yeah,
again, another good question. Look, I'm always going to work closely with the Chief Medical Officer of Health on this. We'll, as we've said right from the beginning, we'll be guided by his advice and the advice of his team. But to be very clear, and more specifically to the residents, there are a lot of lessons that we've learned from the different phases of COVID. And one of the things that we learned is how important it is to have family and friends around and close by the people who are in long-term care. The COVID of today is certainly much different than it was at the outset. Our long-term care homes, the residents in our long-term care homes are highly vaccinated. The staff are highly vaccinated. We are seeing, yes, are we seeing outbreaks? But we're seeing more often than not asymptomatic outbreaks. So there has been a lot of work that has been done to ensure that we can keep our long-term care homes open to family and friends. And it is my goal as the minister, as I said, always guided by the advice of the Chief Medical Officer of Health. Look, I'm cognizant of the fact I'm not a doctor, but as somebody who has, a father-in-law in a care home, I know how important it is that we be able to continue to visit with him, and that is my goal, is to have our homes accessible to family and friends. and to recognize it's a home. Like, you know, these residents are here. They've invited us into their home, and first and foremost, they're the ones that are most important to us. Okay, thanks. That's it. All right, I don't think there's anything else. So thank you very much, and again, thank you both, and thank you to my colleagues who will. I'll just close by saying this. A parliamentary assistant to the Minister of Labour, so when I'm talking about 27,000 additional healthcare workers, this man has to help us get it done. And when we're talking about 58,000 new and upgraded homes across the province of Ontario, the parliamentary assistant to the Minister of Infrastructure will be very, very, very busy and has done extraordinary work to help us get to this today. So thank you all for having us here today, and again, thank you for inviting us to your home.